Dear committee, let me present my 15 months progress. My PhD thesis title is Eating and Feeding Difficulties in Children with Autism Spectrum Disorder from Background to Tailored Treatment. My name is Krisztina Szalkay. I'm a pediatrician and a child and adolescent psychiatrist. I work at Betesda Children's Hospital in Budapest. My vision is a better understanding of autistic children and their families. My mission is identification of potential evidence-based diagnostic and therapeutic targets in autism with eating and feeding disorder. To achieve that, I have 3 ongoing projects. My first specific goal is investigating feeding behavior and sensory profile as early indicators of autism spectrum disorder by using the methodology of systematic review and meta-analysis. What do we know about the background? Autism is a more and more commonly diagnosed neurodevelopmental disorder with a 2.2% estimated prevalence. Early diagnosis is crucial in influencing the prognosis of the disorder, as early intervention can significantly improve the cognitive and adaptive functioning of children with autism. With current screening practices, the disorder is commonly diagnosed late. Underdiagnosis leads to significant personal, family, and societal burdens. In order to improve early detection, novel approaches are needed that move beyond screening with uniform checklists at a single time point. Our study is focusing on the feeding and sensory difficulties, both of which occur at extremely high rates in autism from a very young age and can be permanent over time. Our aim is to investigate the impact of autism on sensory processing and feeding behavior in children, exploring these factors as potential early screening tools. We ask, does the presence of autism in children result in more severe atypical sensory processing and feeding difficulties? We investigate children's population exposure is autism comparators, non-autistic development. The outcomes are severity of feeding and sensory difficulties. We hypothesize that atypical sensory processing and feeding difficulties in early childhood are predictive markers of autistic development. Early detection decreases harmful consequences. This is the clinical implication of our study. I've conducted the systematic search in 4 databases using this search key. After selection process, 46 articles remained. To answer the clinical question, we first compared the autistic and non-autistic population regarding feeding and sensory processing difficulties using standardized mean differences. Then, to understand the relationship between feeding difficulties and sensory processing issues in autistic children, we conducted a correlation analysis. Let me present our most relevant results. The first plot compares pathological mealtime behaviors between autistic and non-autistic children using standardized mean differences in feeding behavior inventories. Overall, autistic children exhibit significantly more severe feeding problems compared to non-autistic children. In addition, all 3 subscales, which refer to different aspects of mealtime behavior, show moderate to large differences. The most pronounced difference is observed in limited variety subscale, indicating more selective eating in autistic children. The second plot shows the standardized mean differences in sensory profile scores between autistic and non-autistic children, comparing atypical responses to sensory inputs. We can see that autistic children demonstrate more atypical responses both overall and across all 7 examined sensory modalities compared to non-autistic children. Large differences are observed in the total score and 5 modality scores. The most significant differences in descending order are found in tactile domain, auditory filtering, under-responsive seek sensation, and taste-smell modality. On the third plot, we analyzed the association between mealtime behavior and sensory processing inventory scores in the group of autistic children. A significant moderate negative correlation exists between severity of sensory processing differences and feeding difficulties in autistic children. The negative correlation indicates that these 2 phenomena move in the same direction due to opposite scoring methods of the inventories. This moderate correlation suggests a meaningful relationship between the two phenomena, while also implying that each captures unique aspects of the autistic experience. The main strength of our study is that this is the first review from an early screening perspective in the topic. The main limitation is the heterogeneity of the measurement methods and study designs. In addition, due to the wide age range, we aimed for age-based subgroup analysis, but limited data availability prevented this. Based on our results, we conclude that autistic children show higher prevalence and severity of eating and sensory disorders, with a significant relationship between the two aspects. Although there is a notable overlap between sensory processing issues and feeding difficulties in autism, the two phenomena are not interchangeable. For the best screening results, it is recommended to assess both areas. Implication for practice: children exhibiting selective eating behaviors and sensory differences in tactile, auditory, and taste-smell domains requires close monitoring for potential autism spectrum disorder. Further research is needed to establish definitive early indicators of ASD based on sensory feeding patterns prior to formal diagnosis. Future research should focus on identifying age-specific characteristics and screening appropriate deviations in feeding problems and sensory differences across different developmental stages. We are currently in the final phase of manuscript preparation. Let me present our second project, what is strongly related to the meta-analysis. We are planning a nationwide survey about early detection of feeding problems and autistic features in Hungarian toddlers and preschoolers. Few more words about the background. In autism, the rate of eating feeding difficulties is extremely high compared with the typically developing population. Our study is focusing on the clinical phenomenon that in many cases eating problems are the first symptoms of autism and appear well before the onset of typical behavioral symptoms. These clearly noticeable, marked symptoms can easily mask the underlying neurodevelopmental conditions, even for years or decades, leading to a failure of appropriate, timely diagnosis and early intervention. Without that, severe consequences can be expected related to both the entry autism, like secondary psychiatric disorders, or eating problems like malnutrition and growth retardation. Our aim is to assess the prevalence of autistic traits and feeding disturbances in general population and examine their potential association to improve the screening methodology for the earliest detection of autism. We ask, what is the prevalence of feeding difficulties and autistic traits in the Hungarian early childhood population? The second question is there a relationship between the severity of feeding difficulties and autistic traits? We hypothesize that the prevalence of autistic traits and feeding difficulties is higher in the Hungarian early childhood population compared to previous data. Our second hypothesis is that the severity of early feeding problems show a positive correlation with the severity of early symptoms of autism. The study has important clinical implications, especially for patients, as early detection and personalized intervention decreases the consequences of both related to feeding problems and autism conditions. For policymakers, the message is targeted early screening practices are required. We target all children in this age group except those with disorders affecting feeding, those on medication that influences feeding, those whose parents are unable to cooperate, and children in institutional care settings. We got the ethical approval working on the pre-study protocol. The questions we are using have already been registered in the REDCap application. Finally, few words about the third project. This prospective observational clinical study is a continuation of our second project. We are investigating the associations between feeding difficulties, autistic trait, sensory processing, and parental stress in early childhood. We will recruit children from two groups. those who identified through the national screening program, and those who presenting at our hospital with eating problems. These selected children will undergo further examination and assessment. In summary, our ongoing projects aim to enhance early autism detection, facilitating timely interventions to improve children's long-term outcomes and quality of life. I would like to thank you for your attention. With brilliant thoughts of Piglet from Bruni de Prou, the things that make me different are the things that make me me. Thank you.